My name is Imran Cronk, co-founder and CEO of Ride Health, and our mission is to ensure that every patient, everywhere, can access the care they need. More than 3.5 million patients every year miss or delay care due to an avoidable barrier, transportation. These are patients who are low income, elderly, they have physical disabilities, they live in rural areas, and these missed appointments and the consequences of care they cause hurt not just those patients, but also their providers, who see $4.1 billion in lost revenue and $40 billion in avoidable downstream expenses. Our vision at Ride Health is a world wherein no patient has to forego care due to avoidable barriers such as transportation. And longer term, we aim to become the global infrastructure to help healthcare organizations and governments assure access to care for everyone. I've written about how transportation barriers impact access to and from care for The Atlantic and for Stat News, and through this reporting have become familiar with other people who are thoughtful about this same problem. And it became clear that there was a need to build a solution that would bring together patients, healthcare providers, transportation services, and insurers. And since then have built out a full-time team that includes an amazing co-founder who's currently pursuing an MD, a team of 2 engineers who are full-time, as well as a customer acquisition lead and a customer success lead. This is all in the past 8 months. Here's a sneak peek at our product. It allows a care coordinator or a social worker within a healthcare provider entity or a health plan or an ACO to easily coordinate transportation on behalf of patients. And this platform automates communication both with transportation providers as well as with patients to help them understand what's happening and to keep everybody on the same page. Patients interact with the system via either SMS, or if they don't have even a flip phone, they can designate an alternate contact, such as a family member or caregiver, to send and receive messages on their behalf, or we also do automated home call-aheads. Our approach is different because we're not a traditional transportation provider. In fact, we don't provide any transportation at all, at least not now. And therefore, we're not incentivized to see as high a ride volume as possible. What we want to do is help our healthcare provider partners call the right ride for the right patient at the right time, and turn patient transportation from a cost center into an asset that helps them ensure better transitions of care, better access to care, fewer no-shows, fewer delayed discharges, better patient satisfaction and experience, and the list goes on. We also work with these providers through multiple modes of transportation, including on-demand ride-sharing services, traditional non-emergency medical transportation for patients who need higher levels of service, such as a wheelchair-accessible vehicle, or door-to-door and even door-through-door levels of service. We pair that with an approach that's highly targeted to identify which patients within a provider or health plan population are likely to miss appointments due to transportation barriers. So this highly targeted approach ensures that the broad spectrum of patients are covered and that the dollars are going toward those who truly need them the most. This is why it's working. In our work with providers and ACOs so far, we've seen 95% on-time arrival to appointments. We're seeing 99% patient satisfaction with the ride experience, and we're saving the ride sponsors 30% on a per-ride basis. It's not mentioned here, but also 100% of the care coordinators who use our product have indicated in surveys that they want to continue using it long term. That demonstrates that this is something they find valuable and time-saving, and it fits within their workflows as care coordinators and social workers. Our momentum is also increasing. We're currently working with 4 health systems as our first partners, with 38 more in the pipeline, with 160 member hospitals across 7 states. We also work with a variety of on-demand and non-emergency medical transportation partners, with several more in the pipeline as we grow our regions of focus. And our providers and ACOs have deployed Ride Health across 100,000 attributed lives, with several million more in the pipeline from both ACOs, MMCs, and MA plans. It's almost noon on the East Coast, where Ride Health is based, and already this morning, almost 5,000 patients have missed their appointment because of transportation barriers. We don't have any time to wait around to act. We have the technology and the partnership infrastructure built, and we want you to join us in bringing that 3.6 million figure down to zero. Thank you.